Now, healthcare workers at the front line of the fight against COVID-19 are increasingly being exposed to the infection, and there's been a constant call by stakeholders on the need for government across the globe to protect them at all costs. Here in Nigeria alone, 117 health workers have been infected, and according to the World Health Organization, at the last count, more than 3,000 health workers, including doctors, nurses, laboratory scientists, have been infected across the world. Sad enough, the health workers are adopting makeshift measures to protect themselves in the face of the shortages of personal protective equipment. And reports say they are patching up damaged protective masks with tape, sadly enough, meant to be used once and thrown away. Now, according to this report, the health professionals are wrapping their shoes in plastic bags because they have no protective covers, and some of them have been said to use their own money to buy protective gear to instead, because there are so many shortages there. And so who is it that protects these people at the front line who are tasked with the job of protecting the people? The question, and that question and more, will be answered by lecturer in the Public Health Department of Babcock University and a fellow of the African Institute of Public Health Professionals. Jonathan Dangana is here with us. Good morning, Jonathan. Well, you heard that was a harrowing introduction. There's so many grave truths and realities. Could you just let's just start with us laying this situation on the table. Just how bad is it for the health workers here in Nigeria?
Thank you. Good morning, and thank you for having me on the program this morning. The situation, confronting the health workers across Nigeria, the narrative is not much any different from where you have in other parts of the world. And then, of course, we are also confronted with unique situation, especially in developing countries where you have what I call a distorted health system. And of course, so that is also a contributory factor given to the burden of what healthcare workers are also being confronted with. And then, of course, the figures keep appreciating as the day goes by. And that does not spell well to the system if something urgently is not done to address that issue.
Good. Jonathan, the frontliners, they're so-called fighting an invisible enemy. I will never forget the story of a mother who was about to go to work, and her 8-year-old daughter, this happened in the UK, said to her mother, "You can't go." And the mother said, "Why?" She said, "I am too young. I don't want to be motherless, And the mother was turned between telling a lie to the young girl, because at that time, the health workers were still fighting the government on PPEs. There were not enough. They were even telling them to reuse. So how do you relate with this story?
That is very pathetic. And like I clearly said earlier, if you can find situation of this nature in a country like the UK, then you can begin to imagine what the reality would look like in a developing country like ours. The issue of PPE has been a long battle discussion, between professionals and the lawmakers, permit me to use that word, or government, as the case may be. And then, of course, this is just because we have not documented our own experiences from this part of the world. It's really disheartening to say. But PPE has resulted to be one of the key points that has confronted health workers and has made the numbers to keep appreciating. Because it's like asking me to go work on your farm, and of course, I know what I'm supposed to do, but you are not giving me the right implement to do what I'm supposed to do. So there is no way you will expect a good harvest at the end of the day in a situation of that nature.
Definitely. You talked about not documenting. Who should be responsible? What should we be doing about it? Because you're talking about tomorrow. We have to take care of these kind of things for tomorrow, to be proactive, to be able to handle those things when they occur in the future. So that's important. Who should be? Why are we not? How do we go about documenting these things?
Wow. That is indeed a very broad perspective. But let me narrow it down to this angle. Number one, even those who are at the helm of affairs as far as the health sector is concerned, before they got to where they are, they have gone through the ranks and the narrative has not changed. And so because of that, we at the front line are aware of what they are also aware of. So it's a matter of who will start what. If it is the issue of documentation, of course, one clear point is PPE. So PPE is a clear cut point. If we want to address this issue head on, then let's start by, what are the basic things that we need to make healthcare workers to do their job the way they ought to do. Mark you, even in the absence of these PPEs, I think health workers, deserve some applause by those at the helm of affairs. And of course, they have not failed in airing out their appreciation verbally. But I think that can go much more longer beyond talking. Let's act the talking by making sure that which is to make me function appropriately, you are also making it available for me to work. You see, now this has placed health workers to work longer hours. Working longer hours will bring about psychological or psychosocial hazard, that the health worker will be confronted with. And then when that happens, then you can be rest assured that every other faculty of activity will also be affected.
Jonathan, at the very beginning of this pandemic, when we realized that there was such a shortage of PPE across the world, you had lots of people galvanize and start creating their own face masks, start making medical apparel. Do you think that those instances of people taking matters into their own hands to try and solve this problem, do you think it's scratched the surface of the shortages here in Nigeria, or do you think more needs to be done to rectify this mistake?
In my opinion, more needs to be done. You can go into coming up with ideas of how your nose masks can go. I mean, the nose masks, as good as it is, I need you to understand that there are some people who are looking at it purely from an economic point of view,
right? Which
is not wrong. But then my point is, yes, you can look at it from an economic point of view. But then there are some basic things that you need to make sure that while you are trying to achieve what you want to achieve, which is to make food available on your table, but also be rest assured that somebody's life is at stake to what you want to do. And that is why we have the NCDC. Through their comms activity, they have made some basic things that, if you need to have a nose mask, A, B, C, D, E, X, should be found in what your nose mask should look like. But then, of course, we are very much a consumer situation. Once you hear nose masks, anything that looks like nose masks, everybody jumps for it. And then, of course, in the long run, creating another problem, for the society. Again.
Yeah, that reminds me of Jonathan Femi, of a story I read of people hawking it on the road, and somebody had to ask for one. He takes it and puts it on up. Maybe it didn't fit. Then he says, give me another one. And then, and he tries it, and this is very dangerous. It evokes laughter, right? But that's very dangerous. I'm referring to what you pointed out there, a while ago, talking about making money, putting food on your table, balancing it, and the fact that this is about life and death. Well, health workers have no choice, Jonathan. They have to go to work, just like journalists who have to go cover stories or read the stories or ask questions like we're doing this morning on the program. But they're fighting an invisible enemy, Jonathan, and it's sad when they get infected. Let's discuss what the real causes of the health workers getting infected are. What causes, what major things lead to their infection at the place of work, their frontliners? And then maybe how do we prevent that?
I think in my perspective, from what I have observed and what I have researched into and have seen very clearly, is the fact that there is late recognition or suspicion of the COVID situation, especially among patients, who present themselves in the healthcare facility. So health workers, there is late recognition. We arrive at that point very lately. But then, of course, the narrative is changing, but it's not changing rapidly as the number of cases of health workers who are being confronted by this situation and people who are coming down with this ailment, is changing. So what I mean is that as the numbers are going up, that is also how the narrative of, having health workers being infected. So there is late recognition. So the question is now, how then do we now be able to address this late recognition? I think that our health workers need training, retraining, and training. Training is never sufficient. Or training is never insufficient. So we need to get training on how to identify, how do you deal with pathogenic, respiratory pathogenic situations, just like the virus. So, and then of course, the virus is not something that you see on the road, that you call it by name and say, hey, COVID, come, and then it will respond to you. No. So health workers need clarity, need more training on how to engage people. And then, of course, I need you to also understand that we are a deep-rooted cultural workforce. In other words, though we have professional training, but, our culture also has a way that, it finds its root in the way we even exhibit our training. And so we need to draw a fine line, between how we deal with cultural issues. So I am a health worker. And then, of course, my neighbor is now coming. While I am supposed to be doing what I'm doing, I'm also doing and then talking about the things that we left undone at home. So, and then, of course, you become informal. And then thereafter, you begin to build contact. And then when that contact begins to happen, of course, that is another way by which, you will transmit or transfer this situation. And of course, you never can underestimate where that contact can lead to. But then again, that brings us back to the issue of PPE. You see, so when there is PPE, even when that contact happens, that will minimize the effects, across board.
Jonathan, we are going to take a very short break. When we come back, we will continue our discussion on how we can protect healthcare workers during this COVID-19 pandemic. Please do stay with us. Welcome back to the morning show here on Arise News. Still with us is a fellow at the African Institute for Public Health Professionals, Jonathan Dangana. Thank you for joining us. Before we went on break, you had just finished speaking or answering Indy's question, and you mentioned that there is a real need for healthcare professionals to get real on-the-ground training to prepare themselves for instances like this. And I want to talk to you about the practicalities of said training. How do you think that would work? Is it possible to have this training now while healthcare workers are focused on being on the front lines? Is there space to do it now? Or would this have to be something, sadly, that would have to wait until we finish handling the business that is this pandemic?
Yeah, so it is still something that is doable, even within the situation. In my opinion, is just for leadership in respective healthcare facilities to look at what their staff strength looks like. So you can have the training in modules or in groups. So you can have, if you have a workforce of 10 nurses or doctors, as the case may be, you have to deal with the first 5 and then see how you can shuttle that in between work hours. And then, because if you are going to say until the situation is done, then it means that you want to wait until when there is nobody again available to be able to take care of those who are going to be confronted with that situation. Okay, so it's still an ongoing narrative, but then it is still something that can be done even within the current situation that we are being confronted with. And then, of course, like I said, training is never enough. It's never enough. And then, of course, when there is a will, there is always a way. So, of course, I am sure that every health professional who is a frontliner, and even those who are coming up, will also want to learn. What are the rudiments? What are the things that one needs to? Everybody has the basic skills. Okay, but then how do you get to prepare yourself in emergency situations of this nature that has taken the world, beyond what the world expected? And then, so, of course, emergency situation requires emergency approach. And then, of course, you can be rest assured that we will learn through the ranks as the narrative and the situation continues. It
couldn't be more right there. I overheard the DG of NCDC talk about, Dr. Chikwunyekwas talk about the fact that they're training people, and then Dr. Sagi Hanire, the health minister, also talked about the fact that they're training people. So it's something that drives home. This is very, I don't know, touchy, key. The fact that there have been cases of hospitals treating COVID-19 patients that are well-to-do for reasons ranging from they don't want to be identified as having COVID-19, to the fact that they were probably handsomely paid to do that, or that they didn't know. Again, when I read this story, my heart was in my mouth. I held my breath until I finished the story. Then I could breathe a sigh of relief. This patient was tested, hadn't come out, ran to a hospital, was being treated by the doctors, the nurses, unknown to them that the person was positive. Then, like what you see in films, police and CDC just came there, everyone was locked up, and they had to be there quarantined for 14 days, and eventually at the end of the 14 days, like we will say, glory to God, none was affected. But look at that situation, and how dangerous it can be to health workers and what should be done. I know that the Dr. Osagi Hanira talked about that. Look at it. What are your thoughts, Jonathan?
Let me take it from a lighter note. There is no healthcare professional that is a witch, if you want to look at it that way. When you come to a health facility, the first thing is to look at you as a human, that you need help. But I really think that there is a growing trend of the fact that people are actually lying about their situation. And this calls for attention among healthcare professionals, that going forward, every health professional should henceforth treat anybody who will walk into a health facility as a potential COVID-19 patient until ascertained otherwise. And I think if we go that route, that might change and bring about a change in the narrative. I mean, even if the person is coming with every symptom that you are seeing, that let's say an ailment like cholera or an ailment like malaria. No, don't take him to be only a malaria patient. But from the word go, the moment the person walks into your premises as a healthcare professional, treat and take that individual as a COVID-19 patient, because there is a lot of falsehood even among patients to doctors. And then that also brings me to the point that shows that we have a sorry case health system. Okay, we don't have a cohesive health system. The private practice, feels independent of government. But then, of course, we are all trying to address the same monster. And then until we look at it from a concerted effort point of view, we cannot win this battle in silos. No, it doesn't work that way.
Jonathan, I wonder if we could switch gears a little bit. I'm sure you would be aware that the Nigerian Doctors Association here in Lagos talked about having a stay-at-home strike, if you will, because of the poor treatment that they had been receiving from Nigerian police, who were trying to strictly enforce the curfew down here in Lagos. What are your thoughts on that? Were you in support of their decision to stay at home, or do you think that this is another instance in which public health professionals haven't been protected and therefore have to take their own power into their own hands and protect themselves in that way? What are your thoughts on that?
It's disheartening to make a comment from this perspective. It's disheartening that a health professional's words cannot be taken, for his words. I mean, before this warning, health professionals have spoken up to say, listen, this kind of treatment is ongoing, but nobody tend to take what my colleagues have been saying out, that this is what they have been confronted with, until an action was taken. Now, that action now warrants that you need to understand that whether you are in leadership or you are in followership, everybody is in the mix as far as this issue of COVID-19 is. So it's disheartening that it had to get to the point where health professionals have to say, you know what, we are going to take a step back, you go deal with the situation and yourself. And then it now became like, I think this thing is true. Let's get back to the drawing board and see where do we need to. But then, of course, he didn't have to get to that position. He didn't have to get to that level before we can now come to say, hey, this is it. And then, of course, this is where I also made the allusion that, you know, we have a disjointed healthcare system. If the system was the system and is operational, how it ought to be in the midst of this reality, all that needs to happen is that there is going to be synergy between every facet of government, every facet that is responsible to ensure that this situation is contained with. Of course, the security apparatus is there, the health apparatus is there, the leadership is there. So you can have these three individuals sit together and then come up with a strategy to say, hey, as far as healthcare workers are concerned, we will have X, Y, Z to say we will identify you as far as this situation is concerned. Even if it means, for instance, to say if you're a healthcare worker, BRT lane is available for you to drive through to get to work. In other words, so that you are not, part of any other traffic that will be made available. So if they see you moving in that lane, it is clear that you are an essential worker, and this is not a normal narrative. We are all in the fight to make sure that this monster is addressed appropriately.
That makes that makes so much sense, Jonathan. Before we let you go, you've talked about not just talking the talk, but walking the walk, action. How can you and I and the government and the health workers themselves reduce their rate of infection? I mean, reduce it to negligible minimum or totally out in just about 20 seconds? Just answer that if you can.
Stay at home until it is important or unless it is necessary for you to step out. If you don't have any business being outside, you have no, stay at home. Because this monster that we are looking at has no name, it has a name, has no parent, and is not a respecter of your status, whether you are rich, poor, or you are an orphan or otherwise. So the first point is, listen, stay at home as much as you can, and I'm sure that this monster can be addressed properly.
Thank you so much. That's our hope. Thank you, Jonathan.